The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk. You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Welcome, Sky community. Welcome back to another episode. You are going to love this episode. If you've ever been told BMI defines your health, or worse, your worth, this episode is for you. Today on Sky Women's Health Podcast, I'm joined by Dr. Janeeka Benoit, also known as Dr. J, an internal medicine and sports medicine physician who helps women lose fat, build muscle, and radically improve metabolic health without shame, extremes, or guesswork. Dr. J's works challenges everything we've been taught about weight, BMI, and what healthy actually looks like, especially for women navigating hormone changes in busy lives and unrealistic expectations. So in this conversation, we will unpack why BMI misses the mark, why muscle is non-negotiable for long-term health, and what body composition really tells us, and how to shift from changing the scale to building strength, confidence, and sustainability. This is a no fear, no shame conversation, just science, strategy, and clarity. So let's get to it. Welcome, Dr. J.
Hi, hello. I'm so happy to be here. Thank you so much for having me.
Yes, I've just been so inspired by your story and your own personal journey with childhood obesity. And I want to talk about how your experiences have shaped your relationship with weight control and education.
Yes, absolutely. So I would say even from the very beginning, as a child, I struggled with obesity. And that also inspired me to learn more about nutrition and exercise. So very interesting, like around 12 years old, I started getting more into exercise. I started doing different sports, and my family comes from a family who eats a lot of rice. And so I started, doing little things by just cutting back on my portion sizes. And I remember coming back into the eighth grade, I was like a whole new different person. And then I would say around college and into getting into medical school, I became a personal trainer. And I got even more into nutrition and exercise and went to medical school and did a sports medicine fellowship and even further enhance my education. Um, and even now that I'm, older, I started dealing with changes in my body. I have been a huge runner. I have ran a New York City marathon. I've done half marathon, and even despite that, I noticed that I was getting increased weight around my midsection. That despite doing all those things, despite doing my HIIT training and doing cardio, I started putting on weight. And also, my LDL cholesterol was high for the first time ever. So I realized something had to change. And during that time, I was working closely with obesity medicine patients, and I realized that some of the things that they were talking about, like food chatter and food noise and things like that, I started to have that as well. And so all of these experiences that I have had personally and how I have worked with patients influenced me to create something of my own to help women deal with all these changes in their body.
Yeah. So you have a virtual practice now, correct?
That is correct. Yes, it's called
Yeah.
Investal Health and Wellness.
Yeah. Very exciting. So you just described a very typical patient in my office who is, in her late 30s, 40s, even 50s, struggling with like the things that I used to do no longer work. That
Yes.
mid drift where that midsection weight gain, that abdominal weight gain that we see, the LDL cholesterol rising, maybe high blood pressure for the first time ever in their life. And they're exercising and they're cleaning up their diet, but nothing seems to be working. And they're trying to figure out like, what's that thing that's going to like, turn the key and the metabolism is going to work like it should or like it
Yeah.
had been.
Yeah. Yeah. Well, I first want to say, like, a lot of this is, symptoms of perimenopause. And really during perimenopause, we see our genetics start to take over, right? So I do have a family history of heart disease in my family. Both my parents have elevated cholesterol. And, prior to my mid-30s, I had no issues with my cholesterol level. And I had really no issues around, increased fat around my midsection. And so just from an understanding standpoint is, that is what's happening. And I always like to tell patients now, it doesn't mean that you're doomed by your genetics, but it's also understanding how do we work with our genetics. And not think that, the end is near, there's nothing else that we can do or that our bodies are broken. And so first off, by the time that women are age 30, we already start losing muscle mass. And so it's really, really important. I would say even in your 20s to focus on strength building activities, because that is going to really help. And then even by the time that you reach menopause, that declines even further. So you can see that already by the time that we're age 30, we're already losing muscle mass. And then that declines even further by the time we reach age menopause. The average age is around age 52. Um, and so number one is making sure that we're getting in strength. And I recommend, 3 days a week, anywhere from 10 to 30 minutes. You don't have to spend hours in the gym, but you just something that is providing resistance against muscle. This can be, doing squats, lunges, yoga, Pilates. Also, it's in making sure that if you haven't done strength training activities, that you get clearance from your physician, because if you're not used to using your muscle in that way, we want to make sure that you're not injuring yourself as well. And so focus on strength training. Another thing that's important is focusing on our making sure that we're getting adequate protein, because the protein is going to support our muscle growth and help to maintain our muscle. And so for protein, I say at least 90 grams in a day. And so now people have different eating preferences. So if you're someone who likes to eat 3 meals a day, you could do 30, 30, and 30 grams. If you like to eat meals but like snack in between, you could do 2 meals of 30 and then two snacks of 15 grams, right? So focusing on strength, focusing on protein, making sure that we're getting our steps in, especially in this age where, the virtual jobs are, more prevalent than usual. It's important that we're getting our steps in. So if you're getting less than 5,000 steps a day, like that's considered sedentary. So bringing getting a walking pad or getting steps out in your neighborhood at least 5,000 or more, it's going to be beneficial. And then things like sleep, right? And so making sure that we're optimizing our sleep, making sure that we're not having, light in the bedroom. Really, our bed is used for sleeping and sex. So not having electronics in the bed, and making sure that you are, tired. Creating a regular sleep schedule for yourself, if that's possible. I know sometimes with women who have kids that can be, challenging.
Challenging. Yeah.
So sleep is also really important. And as people who are menopause, they may have issues with their sleep, and they may need to, be on a progesterone. And sometimes there is this gray area between is, stress causing lack of sleep? Is it, or is it
Is it
perimenopause,
hormonal?
menopause?
Yeah.
Yeah, is it
Mhm. Yeah.
hormonal? And so it's important that we are at least first optimizing for all the lifestyle things. And if you're doing all that you can do and it isn't severely impairing your quality of life, then, speaking to your primary care provider, OB-GYN about it, of
Yeah.
other recommendations. Yeah.
Yeah, I mean, sleep is king, right?
It is, right?
Yeah. I mean, for all of our systems, everything is better
Yes,
when we sleep, and that's one of the
yes,
biggest challenges as we go through this transition, falling
yes,
asleep, staying asleep. I feel like it's universal. Everybody 3 a.m. across the time zones, they're waking up with all their
right.
best thoughts or running through their list of what they need to do tomorrow instead of being able to fall back asleep with ease. So, yeah, a lot of times a trial of some progesterone and perimenopause can be incredibly helpful for that. And then when we sleep better, we make better food choices, we choose to move our body better, etc. Yeah.
Absolutely, absolutely.
So let's talk about the problem with BMI and why women are done with it.
Yeah, so I absolutely love this topic because I see so much of this, even in clinical practice. They will come to me and say, okay, well, my goal is to get my BMI into normal level. And it's just like, what is even normal? Because we have to understand where BMI even came from. So, BMI was created by a mathematician, and he used BMI to study populations, and it doesn't say anything about your muscle mass. It doesn't say anything about body fat. It's really just an equation that includes your height and weight. And so although it is used to determine who is indicated for GLP-1s, yes. However, it really should not be a goal because it's just not enough. It's it's used in the beginning, just to create a basic level assessment, but it's not used it's not an outcome measurement that we use to assess. It's not a metric that we're going back to say, okay, well, you're doing well because we're doing well because your BMI has lowered. Really,
Which is really
what
frustrating because insurance companies are going to
I know
qualify their
based on their
um,
BMI.
based on
I
their
know.
BMI.
And that's exactly right. And that's the issue because yes, we use the BMI, to satisfy insurance purposes, but really it doesn't say a lot because guess what? You can have somebody who does not qualify um within the obese or overweight category for a GLP-1, but according to their body composition, they can have like more body fat than muscle mass, right? And especially if you throw insulin resistance on top of that, that makes it already harder for them to lose body fat. Then those people they're not able to get the appropriate treatment that they need according to insurance. So we really have to understand, like, when we have those metrics, where did it come from, and like what it truly means, right? And so really I use BMI in the beginning to maybe qualify for GLP-1, but ideally, I also use body composition to help me make a much more specific and accurate assessment.
Let's talk about body composition and how you're measuring it. I have an InBody scan in my office, which uses the bioelectrical impedance analysis so that we can get like what is our percent body fat, what are we actually burning daily, what's that basal metabolic rate, what's our visceral fat, which I find is incredibly helpful markers for patients to understand because it doesn't matter whether they step on the scale and they're 135 or 235. You can see people with a high percentage body fat at 135 pounds.
Hmm.
And that composition makes a big difference. So how are you having people get their body composition?
Yeah, so I also like Embody as well. I find that those have been the most accurate. They have a much wider range of frequencies compared to the other bioelectric impedance scans. And so um, if a patient wants to, I recommend in a body scan. Either they can purchase the at home model. The most recent one that I recommend is the H3O model. If they don't want to purchase an at home in body, then I give them a list of in body scans that may be within their area, and they can go to a
Yeah.
gym, yep, and get
Yeah.
their in body that way. So those are ways that I do embody. And I find that that is so helpful. Also, for the people who think they're in a plateau, they're like, oh, I'm doing everything and the weight is not moving, but they've gained like 2 pounds of muscle, and that is huge. And 2 pounds of muscle is a big deal. That is a really
Yeah.
big deal. And so I find that it really helps to, validate, like, okay, I am doing, all the things that I need to be doing. And I see it. I see the results of this in the body scan. And those are the things that, a scale or a BMI just is not able to measure. And that's why it's not an accurate assessment um of tracking our progress with weight
Right.
loss.
Right.
Yeah,
And the in-body scans are just more readily available. So some DEXA machines can also do the body composition, but it's more
right.
expensive. In-bodies are more readily accessible and affordable for patients. So yes, either one, they're fairly comparable. I think DEXA is considered the gold standard, but the
Absolutely.
bioelectrical impedance is also with like in-body is also incredibly helpful. So what particular numbers do you pay attention to? I mentioned some that I really love. I look at those cardiometabolic markers like visceral fat and percent body fat. And giving patients their basal metabolic rate, I think, is incredibly helpful because we may be making an assumption eating a 1,800 or 2,000 kilocalorie diet, but you're burning much less than that.
Exactly. So, right. I look at body fat mass, I look at skeletal muscle mass, and
Of
then
course.
visceral fat. And usually, if body fat mass is lower than skeletal muscle mass, then usually the visceral fat is like within a normal range. But those are the main metrics that I look for. The other thing that's really important to note is understanding what type of body type a woman has, because for women who have ectomorph body types, those are women who like probably were thin all their lives, and then as soon as they reach perimenopause, they're gaining more fat around their midsection, and it's really hard for them to lose weight. There are people with mesomorph body types.
Okay, Dr. J,
They
before you start talking about all this, you have to tell us, what are these body types?
Okay.
Describe them to us.
Yes, yes. Okay. So, like I said, ectomorph body type. So, an ectomorph body type, this is a woman who has typically in her, like when she was younger, was thin for most of her life, right? And then as she reaches menopause or perimenopause, she starts getting more fat around her midsection. But generally, while they were younger, they were typically thin throughout their life. Okay. Mesomorph body type. A mesomorph body type is typically someone, this is like your woman who is like very athletic, during their younger years. They typically have like a large amount of muscle mass. That is someone who is a mesomorph body type. Someone with an endomorph body type. This is someone who really struggle with body fat during their younger years, and they typically have more body fat than muscle mass. And so, even prior to looking um, at the in-body scan, it's also understanding what type of body type do they have, and why is that important? Okay, it's important because, say for example, I have someone who comes to me and says, "Hey, Dr. Jade, like, I don't know what is going on. Like, I used to be so thin when I was younger. I was able to eat everything and would not gain a single pound. And now I am 37, and it's just like everything that I eat just goes straight to my stomach, and I'm developing all this fat to my stomach, and I've never experienced this before, and I just don't feel comfortable in this body because I am not used to this," right? That is classic ectomorph body type. Like, that is typically what you hear, right? And so with someone like that, I would expect them, even though like they were thin while they were younger, someone like that, they probably will have low muscle mass and also a higher body fat mass. And why is that the case? It's because with those people, they typically, they're smaller frame, and so they have a lower amount of bone mass and therefore muscle mass. And so with someone like that, we typically have to sometimes focus on building muscle first before they can even lose the body fat, right? And
Yeah.
so
Yeah.
that's why it's important to understand what type of body type they have, because, and then in addition, having the body composition, because it will affect your strategy and how you help them lose body fat.
Yes, agree, agree. Yeah, we also pay a lot of attention to skeletal muscle mass. So let's
Mhm.
talk about, because you brought this up a couple of times, let's talk about why muscle protects metabolic health, bone health, longevity.
Yes. So muscle mass, number one, is considered metabolically active. And what that means is that it is able to help you burn calories even at rest. And it also helps with metabolic health because it helps to decrease insulin resistance by helping to improve insulin sensitivity. It helps with our bone health because it's going to help with our bones be stronger, which helps later in life to decrease rates of osteoporosis. So, that's why muscle is so important. And we have to ensure that not only are we doing strengthening activities to help preserve our muscle or help to build our muscle, but it's
And
also
keep balance.
and keep balance, most definitely, but also ensuring that we have the proper nutrition to help support our muscle as well.
Mhm. So this common myth that, oh, I don't want to bulk up when you talk about weight training with
Mhm.
women, which, I think is kind of funny because a lot of times women are scared when they go into the gym because nobody's ever, they've been kind of pegged to the cardio machines. And
Right.
usually women are in the weightlifting area and it's a bunch of, sweaty dudes. And, so it's a little bit intimidating, right? So I love seeing that some gyms have like a women's area now where they can go and work out, but I always encourage patients too, just to ask for help because, a gym bro is going to love to show you what to do. Or if you're joining a gym, working with a trainer, and because a lot of times you can get a couple of free training sessions just to show you the equipment and help you understand how to use it so that you don't hurt yourself. But, typically women aren't working out enough and we don't have the testosterone levels to bulk. Like, unless we're doping on testosterone,
Right.
which, I mean, maybe if you have some high levels with your pellets, that might happen, but
Right.
typically that is not happening. Women are not
Yeah.
bulking.
Right. Yes, exactly. And the other thing, for people who, may be concerned about not knowing what to do, if you do have a gym membership, the machines, they're already designed anatomically so that you are doing it correctly from an anatomic basis. So even trying out the machines, they already have the directions on how to do it. That puts you in the proper alignment to do the exercises safely.
That is true. Yeah, they usually do have the instructions on the side. So
Exactly.
take your time. Okay,
Yeah.
so you were talking about how, it doesn't have to be an extensive amount of time lifting weights and moving your muscles with purpose. So, what do you generally recommend?
So yeah, I recommend 3 days a week, anywhere from 10 to 30 minutes, right? Depending on
Mhm.
your time, because we just need enough to activate those muscles, so it really doesn't need another time a lot of time. And the goal is for muscle preservation. So as long as we are stimulating our muscles against resistance, anywhere from 3 days a week to 10 to 30 minutes, like that is enough to help preserve our muscle so that we can also lose body fat.
Yeah. Well, I think that that's a really important point, just doing it consistently and doing it with purpose, just continuing to show up, I think really matters. And we often think that it's inevitable because we hear, the 0.6% muscle loss annually.
Right.
That can be really daunting across the menopause transition because that adds up quickly, right?
Absolutely.
But, I'm a living example because I was working out with a trainer twice a week, and they were forcing me to lift really heavy, and when I got the in-body scan in my office, I got on the scale and, I was lighter. A couple of years later, I'm just intentionally working out oftentimes in my closet hiding from my kids at 5 in the morning before I have to wake everybody up, with just 15-pound weights, but, as many days a week as I could. And I
Yeah.
put on 7 pounds of muscle in a year.
Wow.
Yeah. So I,
Exactly. So
I know it is possible. I try to
exactly.
encourage women that it is possible, even with just
Yes.
small intentional movement. So,
Yes.
yeah, just keep going. Well, okay, muscle preservation is so important for so many reasons, but especially with GLPs. And let's talk about GLPs, appetite, and that muscle conversation no one is really having.
Right. No, I love this. Because I've, have a lot of patients who had placed on GLP-1s, and sometimes what you'll hear is like, I'm not hungry. Right. And so what happens is if we are not getting in the proper nutrition, right, if we're not getting adequate protein and carbs and fats, then that can impair our muscle. And so, with that being said, it's making sure with people with GLP-1, sometimes you do have to do scheduled eating to
And I
ensure
always
that this
tell patients, eat your protein first,
eat your protein first. Exactly. If
Yeah.
anything, eat your protein first to ensure that you are getting those the proper nutrition to help support muscle. The other thing is sometimes they be on a GLP-1 and they are not getting a lot of physical activity. So even just getting physical activity, if it's just walking, can help stimulate your appetite so that you are inclined to eat, right? And again, with making sure that you eat your protein first. And so the muscle preservation, especially when you're on GLP-1, is paramount because the GLP-1, one of the mechanisms by which it works, it helps to decrease your appetite. And so making sure that if we are having a reduced appetite that is impairing our desire to eat, to either do scheduled meals, and if anything, eat your protein first. Or if you're not getting any physical activity, ensure that you, at minimum, getting some steps in to help stimulate your appetite so that you do have the desire to eat and support your nutrition so that it can support your muscles.
Yeah, agree. So this idea that, muscle loss happens because of the GLP, I think that it's simply a myth, because while some lean muscle loss is normal with any rapid weight loss, it can be minimized, maybe not eliminated, but minimized when we're doing our resistance training, when we're taking an adequate protein, when we're staying hydrated and, really focusing on nourishing our body.
Right, exactly. Because there's nothing in the GLP-1s that inherently causes muscle mass. It's usually due to the fact that we are under eating and not getting the proper nutrients, especially protein, that helps support our muscle, causing us to lose muscle in the process. So it's
Yeah.
number one, understanding that there's nothing in GLP-1 that causes muscle loss. And number two, making sure that we are getting our adequate nutrition, especially protein, to help support our muscles.
Yeah. So let's shift the goal from shrinking to strength.
Mhm. Yeah.
So talk to us about how we stop chasing the scale.
Yeah. So I think it's important to understand what the scale even does, right? So the scale is just our gravitational pull on the earth, right? And that's all it really is. And I know it's really easy to get a scale, right? You can, go to Costco and get a scale. And it's just easy to have that scale in your bathroom. At any time, you see that scale, you just step on it and you look at your weight. And a lot of the times, I mean, even me, throughout my years, especially with obesity, is tying our work to the scale and making that number mean something about us and focusing on that number. And even like weighing yourself on a daily basis and then also causing that anxiety around the scale, thinking that if the number is not moving, that it means that there's something wrong with you, that your body is not broken, that things that you're doing are not working. And so I really like to reduce a lot of that stigma that goes around the scale, especially what that number means about us, the scale really means nothing. It really needs nothing. It is just your gravitational pull on Earth. And so if you don't have a scale, that's even better. If you don't have a scale, that's even better. Just throw the scale away, okay? Just throw the scale away, because it really it doesn't mean anything. And as we alluded to earlier, the body composition, that is where it's at, because you can stay the same weight, but you are increasing muscle mass, you are losing body fat, causing your weight to be the same, and then you think that you're not doing all the things that you need to do, and then you start dictating your worth to this number that means nothing. And so it's really important to understand what the scale even means, and it really does not mean anything.
Yeah, weight is information, not a moral judgment. And there's
Right,
so much shame. Women really internalize weight as a character flaw
right,
because society tells us to be thin.
right.
But we have to focus on what does sustainable health actually look like, right? So talk to me about. I would love to hear your journey when you were like, "Hey, I'm putting on this abdominal weight in midlife. I've never had an issue before. What in the world?" How did you overcome that? What are some practical tips that listeners can take? Because, like I told you, I have patients who are working out 6 days a week and they're eating all the protein and they feel like nothing is happening and they're frustrated. But then when I go back and look, they within a 5 pound window, over the last year. And I'm like, well, you're actually not gaining weight, but it's that weight loss resistance that drives them insane.
Yes. So I think, sometimes a lot of it can be stress, right? And so it's making sure that we are um optimizing for those factors. So I mean, for me, as a physician, as an entrepreneur, I will do locum tenens. It was just a lot of stress, and my mind just thinking about all the things that I had to do, and I found comfort in snacking, right? I found comfort on the crunchy foods,
Mhm.
and so I really had to make sure that I was increasing my protein intake, because the protein is important because it helps with satiety, right? And so it helps to prevent a lot of that food noise and that food chatter. And so I started changing the type. It doesn't mean that I stop snacking. I do enjoy snacking in between meals, but focusing on more protein snacks. So, for example, Greek yogurt and berries, or like a rice cake with like cottage cheese and cinnamon, something else that was more protein rich, so I can stop
Than a bag of
having,
chips.
right, than a bag of chips.
Yeah.
Exactly.
But I think, what I'm hearing you say is like, you had to get honest with yourself. Like, hey,
Yes.
there are actually some pitfalls here in my diet that I need
Yes.
to own.
Exactly,
Yeah.
exactly. So it's recognizing that, because I also thought something was wrong with me. I'm like, why am I always thinking about food? I'm like,
The
why
food noise, the
the
food
food
noise.
noise? I'm like,
This
I
is
have
what
to
GLP-1s and GIPs really help with for so many people. It's such a helpful tool because it just quiets that food chatter.
Exactly, exactly. So I was having a lot of that food noise. And so once I changed my nutrition, once I made sure that, okay, my snacks were more protein rich, then that helped to decrease some of that food noise for me. Now, some people, they may have leptin resistance, and more hormonal reasons. So I'm not saying that for some people they do need additional support to help them, but for me, that's what helped, is just making sure that I was getting in some more protein rich meals. The other thing that helped was making sure that I was getting in more strength training days. I was like huge on hit, cardio based hit, and then huge on running. I still love to
Yes.
run, but I really now love seeing how like strong my body is, right? Like I love challenging myself in that way. And so that is I've shifted to becoming more strength focused. I still run like I stated, but it's just fun just seeing how strong my body can be, and like just challenging my body to different levels.
Yeah.
And so those are some of the things that helped. And then listen, once I saw my clothes was fitting better, I was like, baby, we are on a roll.
That's right. That's right. I love it when patients just pay attention to how their clothes are fitting and ignore the scale.
Exactly. And ignore the
Okay.
scale, right?
Yeah. Okay. So, what's one belief that you wish every woman would release this year? Just leave
Yes.
again.
So yeah. Um, I think one belief that I wish every woman could have released this year is that they're not doomed by their genetics, but it's understanding how to work with their genetics, right? Because we know that our genetics can play a huge role in our metabolic health. And it's important how to work with our bodies instead of against our bodies, thinking that our bodies are broken, thinking that, oh, it's just me, I can't be fixed. And we can, it's just understanding our bodies. I think that's also important. It's just like not every approach is not we can't create a one size fit
One
all.
size fits all. Yeah.
Right,
No, I
because our
totally agree.
everybody's so different, right? It's everybody's so different, and so it's really understanding having that, like, mind-body attunement of, "Okay, what works for me?" Like, when I eat this protein-rich meal, how do I even feel in my body? Like, even before like, when I have my food noise, like, what does that feel like for me in my body, right? And so, it's just being more connected, to our bodies and
Mhm.
understanding that we are able to understand our body. And if we need additional support, then it's, speaking to an OBGYN or speaking to a obesity medicine physician, speaking to your primary care doctor to help you with those things that are really impacting your quality of life.
Oh, yeah. Yeah. And I love to pair my patients up with either like a weight wellness program where they're learning about nutrition or with a nutritionist if they want one on one care. So, yeah, I mean, there's always resources available. Okay. So, let's talk about one habit that creates the biggest return on health. If you could tell a woman to do one thing, what would it be?
Okay, one thing is have one piece of protein with one meal. That's it. You don't have to measure, you don't have to weigh, just one protein with one meal. And so if you are, this could be chicken, if you're for dinner, shrimp, lentils, just make sure there's a protein on the plate.
I love it. I love it. Okay. Well, tell us where we can find Dr. J and how women can work with you.
Yes, so I'm active on Instagram at Hey Dr. J. So that's Hey HEYDRJ underscore. I'm on LinkedIn as Janeeka Benoit, and I'm also on Facebook as Janeeka Benoit. And then my website is InvesselHealth/home.
Perfect. So, I would love for our listeners to reflect on what's one health goal that you're committed to this year and what's been holding you back. Until next week, be well. Thanks for listening. This episode is sponsored by Sky Women's Health. If you love this episode, follow the show so you never miss one. Share it with the women in your life and help more people discover it. Let's make it binge worthy.